So now we are going to discuss about the assessment station. So there are so many such scenarios which are running in the test center at the moment. So please go through the scenarios which is given in the learning portal of the test center's website. So in this station, you will be checking the vital signs of the patient, including an A2E assessment, which is airway, breathing, circulation, disability, and exposure. You are also required to document the vital signs on the News 2 chart. You will be using a green pen to complete the documentation of the vital signs. Any error in documentation of the News 2 chart can result in failure of the assessment station. You are also required to conduct a holistic assessment of the patient's physical, psychosocial, spiritual, and sexual care needs. Depending on the patient's condition and circumstances, you may wish to focus on some assessment in more depth than the others. Now, let's discuss about the assessment station in more depth. Gel hands with 6 steps of hand hygiene and check the area for safety. Communication is very important, so use a calm voice. Speech should be clear, body language is open, and also maintain an appropriate personal space. Introduce yourself and gain consent from the patient. I'm checking the area for safety. It is safe to enter. I'm gelling my hands with 6 steps of hand hygiene. Good morning.
Good morning.
My name is Esther and I'm your nurse today, and I came here to do an assessment. Is that all right?
It's all right.
Ask for vision or hearing problems and whether English is their preferred language. Also, if the patient has hearing aid and if they want to wear it, please help them to wear the hearing aid or glasses. If patient is uncomfortable, make them comfortable by giving appropriate position. Check the identification of the patient. Ask the patient's full name and date of birth, and check this with the document, and after that, check the document and the wristband. Can you please tell me your full name and date of birth?
Patricia Williams, 12/8/1967.
All right, what's your preferred name?
Patricia.
Do you have any vision or hearing problem, Patricia?
No.
Okay. And is English your preferred language?
Yes.
All right. Patricia, can I cross-check your name and date of birth with your ID band, please?
Yes.
Okay. Can I see that, please? Patricia Williams. It's Patricia Williams. Date of birth is 12/8/1967. 12/8/1967. Hospital number is 12345. It's 12345. That's right. So, thank you very much. Are you comfortable now?
Not really.
Okay, I can see you are struggling to breathe.
Yeah, I have breathing difficulty and cough,
Okay,
Yeah.
all right. Do you want me to lift your head up?
Little bit.
Okay, I'll do that. Just tell me when you want to stop.
Yeah, that's
Comfortable?
Yeah.
Okay. All right. Are you okay for me to proceed with the assessment?
Yeah.
Okay. I can see you are on oxygen. So
Yes.
just checking the flow rate. Yeah, you're on 2 liters of oxygen. Are you comfortable with this?
Yes.
Okay. Ask for any allergies and reaction and check this against the red allergy band. If you forget to check the allergy here, this will definitely result in a failure. And Patricia, I can see you're wearing an allergy band. Are you allergic to anything?
Yes.
What are you allergic to?
Penicillin.
All right, it says here in the document. Can I check your allergy band? It says penicillin. And what reaction you get when you take penicillin?
I get rashes.
Okay, so you get rashes. All right, so while you're here, we'll make sure we won't give you any medicines with penicillin, okay?
Okay.
Also address the bedside table of the patient. Any cigarettes, lighter, and medications need to be locked away. Patricia, I can see some paracetamols on your table. Is that yours?
Yes, it is mine.
Okay. So actually, while you're here in the hospital, we will administer all your prescribed medications, okay?
Okay.
So for safety reasons, can I please lock it away?
Yes.
Okay. Thank you very much. I'm locking it away. For a preoperative patient waiting for surgery, and if the patient is nil by mouth, water or any eatables on the table needs to be taken away. And did the doctor explain to you that you are posted for a surgery today?
Yeah.
Actually, you're going for surgery at 9 o'clock in the morning.
Yeah.
And you are not supposed to eat and drink anything. It is to prevent complications during anesthesia.
Okay.
So I can see this bottle of water on your table. For safety reasons, can I please take this away?
You can, yeah.
All right, yeah, that's fine. Taking this away. Okay. Establish the reason for admission and diagnosis with the patient. And do you know the reason why you are here?
Yes, I have breathing difficulty as I told you,
Yeah.
and I have cough as well.
Yeah, and you are actually diagnosed with pneumonia, a chest infection. You are aware about that?
Yes, I'm aware of that.
Okay. Now check the vital signs of the patient, including an A2E assessment. Remember to check the respiratory rate and pulse rate each for 1 full minute. There is no need to remove the patient's clothing to assess exposure. Please ask the examiner if you require any additional information. Document the vital signs on the NEWS2 chart using a green pen and verbalize the NEWS score, monitoring frequency, and whether escalation is needed or not. I would like to proceed with the vital sign checking. Is that okay?
Yeah, it's okay.
Okay. Can you please open your mouth? Okay, there is no visual obstruction. That's clear. So I can see you are using your accessory muscles for breathing because you told me you are struggling. But is this position okay for
It's
you?
okay.
Okay. But your chest movement is fine. So that means there is equal air entry on both your lungs. And there is no cyanosis. You are not sweating. There is no seesaw breathing. I cannot hear any respiratory noises at the moment. Okay, now I need to check your respiratory rate for 1 full minute. So can you please just cross your arm across your chest like this? So I'll count the rate for 1 full minute. Alright, that's fine. So your respiratory rate is actually very high. It's like 28. So you're really struggling to breathe, isn't it?
Yes.
Okay, so just document that. So your respiratory rate is 28. I need to check your saturation as well. But before that, I need to check your capillary refill. I'll be pressing the tip of your nail bit for 5 seconds, okay? So there is no pallor, perfusion is fine. So I'm just pressing the tip. 1, 2, 3, 4, 5. Good capillary refill, okay? So the normal refill is less than 2 seconds and your capillary refill is fine. So I'm attaching the saturation probe on your finger, okay? Alright. And also, I need to check your blood pressure. You can put your hands here. I need to check your blood pressure. Which arm do you prefer?
Right.
Your right arm, okay? The curtains are already closed to give you privacy.
Okay.
Is it okay if I expose your arm minimally?
Yeah, it's alright.
Alright. So I'm just exposing it minimally. Okay. Alright. So I cannot see any infection, inflammation, fistula or cannula. It is no skin lesion. It is safe. Have you had any surgery on this side before?
No.
Okay, that's fine. So the blood pressure cuff is of the correct size. Okay. I'm just applying this 2 to 3 centimeter above the brachial artery. Let me know if it is too loose or too tight. Okay. Alright. So I'm going to inflate this cuff. You feel some tightness. Let me know if it is too tight.
Okay.
Okay. Your SATs are 98. So I'm just taking this off. Okay. Your blood pressure is 108/76. Okay. So I'm just gonna document that, alright? Saturation is 98 and you're on scale 1. You're on 2 liters of oxygen via nasal cannula. And your blood pressure is 108/76. So 108/76. Okay. Now I need to check your pulse rate. I'll be counting your rate of pulse. Okay, for 1 full minute. So, which arm do you prefer? Which one? Okay. All right. And place this here. Alright, your pulse rate is 80. Okay, so the rhythm is normal, the strength is also good, it is not weak or bounded. Okay. So that's 80. And so I already checked, there is no pallor, the perfusion is good. I checked the capillary refill. So you are actually talking to me, so I can see you are alert. Do you know what your blood glucose level is?
No.
Okay, as I said, can I please know the blood glucose level?
5.
Alright, thank you very much. So that is fine actually, okay? The normal is like 4 to 7.
Okay.
So 5 at the moment is fine. Okay. And are you passing urine okay?
Yes.
Okay. Any pain, urgency or frequency when you pass urine?
No, not really.
Okay. And do you have any constipation or diarrhea?
No.
Alright. Any pain anywhere?
Yeah, I have chest pain.
You have chest pain?
Yeah.
Okay. Is it when you are breathing?
When I cough, it increases.
Okay. So it's only when you're coughing.
Okay.
Are you having any pain at the moment?
At the moment.
Okay. So when you get pain, how would you rate that? Like from 0 to 10. 0 is no pain, 10 is the worst pain.
5.
Alright. So just let me know if you need any painkillers. Are you okay at the moment?
Yeah, I'm okay.
Alright, that's fine. Okay, then I need to check your temperature as well. So I'll be using a tympanic thermometer that goes into your ear. So which ear do you prefer?
Right.
Okay. Actually, I can see that your oxygen, this is falling down. So just adjust that. Okay. Alright. Are you okay? Okay. So I'm going to use a tympanic thermometer. Which ear do you prefer, sorry?
Right here.
Right here. So I'm just checking your ear. So there is no infection, no hearing aid, no nothing. So it is safe, okay? Are you feeling all right, Patricia?
Yeah, I'm alright.
Okay. So I'm just inserting it in your ear, okay?
Okay.
Okay. So as I said, the temperature is 36.2. So I'm going to discard it in the clinical basement, the ear prop. Okay. Alright, so I have documented that. So I'm going to document that. 36.2. And do you have any bleeding injuries or bruises anywhere?
No.
Okay, everything is fine. Okay, so I'm just going to calculate your early morning score.
Okay.
So it is 6, and I'll be monitoring you every hourly.
Okay.
I'm going to escalate that to the doctor. The doctor will come and review you again. Okay? Okay, can you just brief me about your past medical history?
I have COPD and hypertension as well. I'm taking medications for those.
Okay, so your COPD, I'm sorry, actually you are on scale 2, so I need to strike this off because I have wrongly documented in scale 1. So your early warning score will be different. Okay? So thanks for letting me know. The doctor has also advised to document on scale 2. So your saturation was 98 and you are on oxygen. So actually your early warning score is 9 and we'll be monitoring you continuously, okay? I will be escalating this anyway and the doctor will come and assist you as I already told.
Okay.
Alright. Okay, so apart from that chronic lung disease, do you have any other problem?
Hypertension. Yes.
Alright, and are you on any medications for that?
Yes.
Okay, that's fine. I'll check your prescription because I can see you are on some regular medications, some inhalers and other cardiac medication.
Okay.
So I'll check the prescription and if the doctor has prescribed it, we will administer accordingly. Okay?
Conduct a holistic assessment relevant to the patient scenario and give relevant health promotion.
And you told me you have cough.
Yes.
Are you coughing up any sputum?
Yes.
Alright, what color is that?
It is yellow.
Okay, yellow color. So what I'll do is, after my assessment, I'll give a specimen bottle. So next time when you're coughing, try to collect some sputum in that. I will send it to the lab for further investigations. And I will also escalate that to the doctor.
Okay.
Is that okay? Alright. Try to drink like many fluid, like 2 to 3 liters of fluids. Okay, as you tolerate it.
Yeah, but since 2 days I'm not able to eat or drink anything. I don't feel like.
Okay, are you not feeling hungry?
No, I don't feel hungry.
That is okay, like if you can eat small frequent diets, even if you're not feeling hungry, if you don't eat at all, that can actually cause more problems. So try to eat small and frequent diet and we'll maintain a food and fluid chart to monitor your fluid intake and food intake. Try to drink plenty of fluids as much as you can. Okay, so that will keep your mouth moist because you're on oxygen. That can cause dry mouth. Okay, and also like if the secretions are too thick, so it will actually help you to thin the secretions and you will be able to cough it out. Okay? And I will refer you to a physiotherapist as well, chest physiotherapist. They'll come and teach you some coughing and deep breathing exercises. So if you do that, that will also help you to cough out the sputum. Okay? And where you got chest pain, so we will administer the prescribed painkillers before you do all those exercises. Alright? And also like use tissues when you are coughing and you can discard it in the bin. Okay? Maintain good hand hygiene. It's just to prevent spread of infection. Okay. Any other problem you have? Have you had a good sleep last night?
Yeah.
You had a good sleep.
Yeah.
Okay. That's fine. Is there anything else that you are concerned about? Would you like to see your family members?
Yes, I would like to see my husband.
Okay, that's fine. Actually, the visiting hours are from 2 till 6 o'clock. Okay, so you can bring your husband if you know, or else I can bring him on your behalf.
Could you please do that for me?
Yeah, I'll let him. Okay, so your family and friends can come and visiting you during the visiting hours.
Okay.
All right?
Yeah.
Okay. Do you need any spiritual support?
No, not really.
All right. And I can see you're wearing hospital gown.
Yeah, because I want to wear my own clothes, but I have not got any here.
Okay.
So I want my husband to get them as well.
All right. So when I ring him to inform him about the visiting hours, I can tell him to bring your own clothes.
Yeah.
Okay, so that you can wear your own clothes.
Okay.
Okay, that's fine. Another thing I would like to tell you is like if you are moving out, please press the call bell here, okay? Because you are on oxygen, so we will come and help you with a portable oxygen cylinder. We will assist you.
Okay.
How is your mobility otherwise?
It is fine.
Do you use any walking aids?
No, I don't use
Okay.
any.
And also it's good if you wear like your own shoes,
Okay.
well-fitted shoes to prevent any falls. Okay.
Ask for any other concerns the patient may have. Make the patient comfortable Ensure call bell is within reach. Before leaving the patient's bedside, make sure to gel hands again with 6 steps of hand hygiene.
Is there anything else that you're concerned about?
No.
Okay. So we are here to help you. The call bell is here. Any problem, please do let me know. Okay? And also, I will escalate your vital signs and all the problems to the doctor. Okay? Thank you very much, Patricia.
Thank you.
Okay. So, as sister, I've done the assessment. I've done the documentation. I'll be escalating all the relevant things to the doctor. I will also clean this vital sign machine after my assessment. Thank you very much. Enjoying my hands. 6 steps of hand hygiene. So I'll continue with the neurological observations now. So I can see you are opening your eyes without any stimulation. So that is spontaneous eye opening. Elizabeth, do you know where you are now?
No, I'm at home.
Elizabeth, actually you are in the hospital.
Oh.
Yeah, you are admitted here with headache and fall.
Yeah.
And you are having a bleeding in your brain. Okay? And I'm your nurse.
Okay.
Okay? You are in the hospital.
Okay.
Can you tell me your full name again, please?
Elizabeth Parker.
Okay. Do you know the date today?
I know which month it is, but not the date and year.
It is 16th of Jan 2022.
Okay.
Alright, so you seem a bit confused. And can you squeeze and release my fingers, please? Good. With the other hand, can you try? Yeah. Okay, it's really good. Okay, so that side you had the paralysis,
Yeah.
but it's okay now.
It's okay now.
Okay, so you're obeying commands. Now I need to check the size of your pupil. Okay, can you just look straight? I'm going to obstruct the light from above. And I'll just compare it. Okay, the size of your pupil is 4. Now I need to check the reaction of your pupil. Okay, I'll be flashing a light on your eye. Just look straight. Don't look at the light. Okay, I'll be checking both eyes. Other eye. Okay, both are reacting well. Now I need to check the strength of your arms. Can you straighten your arm like this? I'm going to apply pressure from above. You need to resist it. Okay, actually your right arm is having severe weakness, but your left arm is okay now. Okay? So, right arm severe weakness, left is okay. Now I need to check the strength of your legs.
Okay.
Okay, I'll be lifting your leg. You need to try to resist it.
Okay.
Okay? Is it okay if I uncover you? Minimally? Okay. So I'm gonna lift it. Try to resist. This is actually weak. Okay, both your legs are weak. Okay? The right is having mild weakness, the left is having severe weakness. Alright. Oh. So I need to calculate your GCS score now. Your GCS is 14. That's because you're a bit confused. I'll be monitoring you every 30 minutes.
Okay.
The reason why we are monitoring you so frequently is to look for symptoms of deterioration, because you have a bleeding in your brain. So if you have like blurred vision, if you feel dizzy, severe headache, okay, please do let us know.
Okay.
Okay? And also like your arms and legs are weak, so you had falls,
Yes.
okay? You are still at high risk of falls.
Yeah.
So what I would advise is, don't try to get up on your own.
Okay.
We will come and help you. Press the bell if you need help. The call bell is here.
Okay.